Hi everyone, my name's Sonja. I'm the Senior Technical Advisor in the Skills Development Program. It's a VSD, Vocational Skills Development Project of SDC, implemented in Cambodia. And I have the pleasure to share with you some experiences that we've made during this year of the COVID-19 pandemic. So first, I want to introduce you a little bit to the project. We've got 4 intervention areas. And as you can see, the one that I'm presenting today is part of the intervention area 4, which is called Hospitality Kampuchea, Kampuchea meaning Cambodia. And we are implementing this in 5 rural provinces, highlighted here in pink in the map. It's probably a bit small for you to read, but the ones familiar with Cambodia will be able to locate where we're working. And I would like you to know that the tourism in those 5 provinces is mainly dominated by local visitors. So a lot of Cambodians like to visit those areas for their attractions. Prior to the pandemic, there was also a number of foreign visitors going there, but the big majority of visitors, as Lars already mentioned in his introduction, they want to travel to Cambodia to see the famous World Heritage of the temples of Angkor in Siem Reap, highlighted in yellow in the map. And let's continue. Tourism, as all over the world, was heavily impacted by COVID-19. You can see here that prior to the pandemic, Cambodia had around 7 million visitors annually, and that dropped dramatically to a fraction of the visitors that the country used to receive before. That's mainly because of the tourist visa being completely suspended, and they're still suspended, so tourism is really suffering a lot. The tourism sector, however, is a very important source of income for many people in this country. So as per data from 2018, around 600,000 people were working directly in the tourism sector, and around close to 2 million people were in industries related to that. And places like Siem Reap that are basically building completely, or were built completely on tourism, that's where the people are feeling this impact the most severely. Here, we've never had an actual lockdown, but frequent incidents where there was usually there was a community outbreak that was contained, and right now we are suffering the worst community outbreak since the beginning of the pandemic, which usually then results in the first response to close all schools and government offices and ban all public gatherings. So that's the challenge that we have working in vocational education and training, disruptions of the services that we would like to improve. So I'll continue here. So when COVID-19 hit Cambodia, that was everywhere else about a year ago, we struggled with the fact that face-to-face training was no longer feasible, no longer possible. But we were actually at the end of the phase, and we had just started this very exciting project of implementing a cooking training that was, of course, being done face-to-face in a well-equipped kitchen with fantastic trainers, and the learners were enjoying themselves, upgrading their skills. So the beneficiaries are low-skilled workers that are very motivated to upgrade their skills in order to pursue a career in hospitality. So we had to respond very quickly to this situation and make sure that we could finish this course and give the learners the opportunity to terminate what they had started. But obviously, the motivation of the students was quite low to access training in these circumstances, and then later on it was even forbidden. So we struggled with these constraints. So asking now, but wait a minute, so what did you do? You had a cooking training and you took that online? Yes, we did. We took cooking online, And we basically did that in a very improvised manner, because I think, like many projects, e-learning and blended learning, distance learning may have been a component of what we were doing before, but it was arguably a very small part, because we didn't have to focus on that, because a VET training, vocational training, is usually best done when you can actually apply in the workplace, in practice. So e-learning is basically just a supportive function in this form of training. So we were forced to take this training online. And how did we do this? We had an online cookbook, we had online assignments and written assessments for the students, but then we used digital solutions to continue the training. So we used Zoom in order to deliver the theory classes, the instructions, the demonstrations. So the chefs that were delivering the training were demonstrating the cooking process of all the dishes that were in the curriculum. And then the students also submitted their response to assignments through the Zoom calls. And even the final assessment we did on Zoom, with everybody sitting over their assessment papers with an open camera and microphones on, and basically the trainers were supervising them that way. Of course, you may think that there are probably more sophisticated ways to do that, but there were reasons why we chose this solution, which I will talk about in a minute. We also started adding other tools like Kahoot and Mentimeter for engagement and fun, and quizzes and evaluation. So there was this interactive element. And the trainer guided the learners through these activities. Then the assessments were done at home. So some of them were done online through tools like Mentimeter, but the assessments were actually done at home and then sent to the trainer for verification. Important aspects that we would like to mention in terms of e-learning. So we work in a very area of Cambodia, and the learners that we engage in our program, they're not very tech savvy. They will know applications like Telegram or Facebook and Facebook Messenger, but these are not typically tools that are used for e-learning. So I think even for our own team, that was the starting point, because that's what we knew. And I wrote here trial and error, because that's really what it was. We had to find out what worked for us, and we went from very unpractical tools, like I just mentioned, Telegram or Messenger, to very good, useful tools like Google Classroom. Only realized that actually the learners were really struggling to use this platform, and that they were just not finding their way around it. So we were jumping back and forth between tools until we found that Zoom was the way to go. Now, of course, looking back on a year of online calls and online collaborations, we are all at the point where we say, how could you not know that? But I think we tend to forget how much we have all learned in this year regarding teleworking and online collaboration. We used the existing course material that we had produced with the purpose of face-to-face training, but we also added self-produced content, so videos, for example, that the trainers were recording and then setting or uploading for the learners to watch at home while cooking in their own kitchens. And we had, thankfully, very thankfully, experienced technical experts, qualified trainers, to facilitate the training. And they were very willing to go this path with us and to learn which tools worked. So the learners were actually cooking the meals at home in their own kitchens based on the guidance they received from the trainers in the Zoom calls. And then they showed their preparations, like this lady here in the photo, and they got feedback on how they had prepared their food, and then they went on to make the meal, and then they presented that to the trainer. We were very fortunate as well to have an in-house support team who is quite tech savvy. That's our MRM team, so Monitoring and Results Measurement team, a young and dynamic team who knows a lot about online collaboration. So thankfully, our hospitality team had in-house advice. But of course, as you can imagine, we faced a lot of challenges in this implementation. Connectivity, I don't need to tell you anything about that. I think we've all experienced the issues of the internet. Then the students' ICT capacity, as I mentioned, most of these that we train, that the students, they are not very tech savvy, so we're dealing with a low tech environment where students were finding it really difficult to study online. And we also had to motivate the students. We had trouble to engage them because they were actually forward to this training to be in a group all together, and then all of a sudden they were stuck at home with a lot of anxiety around this pandemic, with worries about income losses and so on. So they were reluctant to continue the training. Working or learning from home, as I think we all know by now, is usually prone to quite a lot of interruptions of various natures, and that happened to our learners as well. And then we had the biggest problem that we actually faced was that practical learning was missing. So I think that we will come to that second. In terms of challenges, the practical application of the skills under the supervision of the trainer was just not possible. And activities, therefore, should always be combined with face-to-face activities if possible, which it wasn't in our case. Lessons learned. We've learned a great deal, and what we found is that after a bit of reluctance at the beginning, the learners became more active and self-motivated. The more fun and interactive tools we started adding to the training, the more engaged they became. And actually what happened was very interesting. They started exchanging among themselves. So it wasn't so much the expert teaches them and they are learning only from the expert, but they were actually finding it very interesting to exchange in the various chats that they had among themselves and exchanging the challenges on the different dishes that they were cooking and helping each other out. So it was added peer-to-peer learning factor that maybe wouldn't have been there if we had continued face-to-face. Practical learning offered more flexibility to them, so they were able to repeat the process several times at home if they wanted to, and they were able to practice in their own home. So I think maybe also a bit more at ease without the watchful eye of the trainer. We learned that this e-learning can also help to save a lot of costs. So as we worked in these remote provinces, we didn't have to send our trainers there, and we didn't have to rent the kitchen space to deliver the training and so on. So we saved a lot of costs through this modality. And last but not least, I think what the bottom line is, it was very interesting, and it was a way to save this training and to bring it to a successful ending, but it's not a panacea for disrupted training provision. Nowadays, we hear a lot about e-learning and blended learning, and I think we need to be very clear that there is a difference between e-learning and blended learning, because blended learning actually implies that you have a practical application element in the training where you can practice in a supervised environment or in a workplace the skills and apply them with that. And with e-learning alone, we can't do that. So e-learning cannot fully fix the issue of disrupted training provision. Last but not least, I want to give some credits to my wonderful teammates here in Cambodia who through this wonderful experience, this great challenge of taking cooking training online. It is my colleague Dara, who is leading a wonderful team of hospitality experts here in Phnom Penh, but also in the field. And I just want to give them this recognition because it was very, very challenging for them. I think they were completely pulled out of their comfort zone for a while there. And what I find most impressive is they made it their new comfort zone, and everybody's so at ease now collaborating online and delivering training online. So that's wonderful to see. This learning experience that our own team has been able to have thanks to the pandemic.